Hello and welcome to our 8th regional report out call. This is February 2nd, Groundhog Day. Happy Groundhog Day. Unfortunately, Punxsutawney Phil saw a shadow. We got 6 more weeks of winter. Bummer. And hopefully he's wrong because he's only right about 50% of the time. We are here to talk about the Northwest region of Kansas. Good news today. And one of the areas of news, I'll start with our calls. We've been doing them every week now for 8 weeks. We are now, with state leadership, feeling good about moving to every other week. So we won't be here next week, but we'll be back February 16th and then again on March 2nd. And just want to encourage you to sign up with your email address on our website. That is covid.ks.gov/report-outs. covid.ks.gov/report-outs. Sign up, Northwest region. You'll get an email as soon as we're done. You can get a quick update. We're trying to shorten the calls too. Also, just to get the information where cases are at, how the hospital system's doing, and what's going on with the vaccine. So you can know what's going on in Northwest Kansas. Let's look at the numbers, if you will. Pull them up. Kansas Hospital Association so kindly puts this together for us every week. Here's Northwest Kansas. And I'll look at the numbers here. No one reporting critical staffing issues, which is good. This is obviously was a pain point through November and December and began to ease in January. Still asking a lot of our frontline workers. So thank them when you see them. Buy them a drink, whatever you can do. They deserve it. Coming over here to the COVID patients inside the system. Northwest, this was 52 last week, 23 this week. That's great. Number of ICU beds with COVID patients, 2. Last week was 6. What I'm hearing across the state very consistently is that most hospitals are 40 to 50% of the COVID patients they were during the peak, which is really good news. Available ICU beds, 13. That's been the number it's been hanging at for about 3 weeks. So that's 54% of the beds in the area. That's good capacity, especially given the time of year that we're in. A lot of non-COVID people needing care. Also, great story here. Peak, scary time in November. Northwest Kansas responded. Numbers been getting better, down to 181 this last week. A positivity rate of 6.65%, which is right by where the state data is. We had the lowest I've seen since September this past week as a state, 6.4%. And just on a grand scale here, 2,500 cases a day at the high point for the state of Kansas. 2,500, now 650 per day is what we're averaging. So continue to head in the right direction, which is good news for Kansas. I'm also going to flip over here to the vaccine, kansasvaccine.gov. They're rolling out Find My Vaccine tomorrow. If you click on data, you can see this was I think 4.5% last week. Now 6.4% of our population has at least one shot, which is good. You can see first dose, second dose is around 45,000 people have been fully vaccinated. We do still believe these numbers lag with the process to enter all of it into WebIZ is very cumbersome. Added this week too, you'll see the federal LTC, that's long-term care program. This is through Walgreens and CVS. Feds direct to those programs. We are able to put those numbers in now. And what I'm hearing from the Secretary of Health is that we are 3/4 of the way through long-term care patients, which is great. Hopeful to be finished by the end of the second week of February. It's a very vulnerable population, but they are really doing their best to work through that group and be helpful. And then you can see just the stats of the people who've gotten the virus or gotten the vaccine, much better V word there. And then vaccines per day, first and second doses. But this is one I think a lot of people want to pay attention to. Want to be clear, the issue with vaccine is supply side, not distribution related. What we're hearing across the state is the goal is by the time they get it in to have it out in arms in less than a week. Most places probably averaging 2 or 3 days. Some places getting it out same day that it arrives. A lot of counties, this is by county health department, have organized their systems. But just to paint a picture, 800,000 Kansans fall in phase 2, and we're getting about 50,000 shots a week. May get that up to 60,000 here with the increase. And you can imagine how long it's going to take to vaccinate 800,000 people when we're only getting 60,000 shots a week. And we got to put it in twice with both the shots that are available. We're hoping the supply will increase, but right now it's a slow drip, and just understand that there are supply side constraints as they're trying to make this vaccine, manufacture it, and get it out to people. But you can go through and see what your county is getting. The more rural counties are getting about 100 a week right now. Ellis County, which has more population of 400, but you can go through and see what's going on in Northwest Kansas here. Great website. We're very grateful for it. So there are the numbers. We don't, again, have anybody from public health this week, which we understand because they are both out doing vaccines, and that's where they need to be. But we have Reagan with us, talk a little bit about what's going on from her perspective with hospitals and any news she has on the vaccine. Reagan?
So thank you, John. I'm Reagan Cusimani. I'm the Director of Governmental Affairs for the University of Kansas Health System, which includes HaysMed, Pawnee Valley Larned, and Great Bend. So I think the good news continues from the perspective of the number of positive COVID patients that we have inpatient at the hospital. At HaysMed, if you recall, we were pretty high up there in the prime of this epidemic there in November and December. And we are happy to report today that we are at 12 inpatient, and of those 12 inpatient, 4 are active. The remaining patients are recovering. And Great Bend is at 0. So Larned is at 3, and that's 1 active and 2 recovering. And just to give a little bit of perspective from a metro area in Kansas City, we were running, upper 160s, 170s very easily. And today we are at 102 with 36 that are active and 66 that are recovering. And we do get sometimes questions about what does recovering mean? That means they're not actively infected, but they are not able to leave the health system at this point. They're still needing some assistance with oxygen. They're still needing some medications. They're still needing some treatments to kind of help them be stable. So that's the difference with somebody who is active versus somebody who's recovering. So vaccine wise, we are pretty close to we were part of phase 1 since we are in healthcare. And we have found that our system has seen a really good response to getting the vaccine. We had some who were what we referred to as deferred. So those employees deferred through the first round and said, maybe I'll come back, or they had at one point in time had COVID and still had their 90 days of antibodies. So those people are picking up. We have a group coming in here over the next couple weeks for their second doses. And so I think it's been a good response. We feel very comfortable. We think that it has impacted our staffing and our ability to have staff available and ready. We're not seeing that crunch that we saw in the past due to the number of infected or COVID positive employees or out because they had a child or a family member. So we're really feeling pretty good at this point. Definitely, I think I can confidently say we're feeling a lot better today than we were end of November, beginning of December.
Thank you, Reagan. And do you know, are the hospitals partnering with the public health departments on helping get the vaccine out there, or the public health departments handling it themselves?
It kind of depends on what area you're in. So there are some health departments who are just handling this on their own. And I think fair to say that if you live in a more rural county, there are many of them that may only have 3 employees in the health department. And so it's very difficult for them to plan and facilitate those vaccinations. So they are working with larger health systems like HaysMed in order to get the maximum number of doses out in the allotted time to residents of the region. So in some of the bigger metro areas, I think that's a little bit easier because they have larger health departments that have more employees that can assist. But yeah, we're kind of seeing kind of a county by county variation as to who's working with hospitals and who are just kind of doing them on their own.
Okay. Yeah, important for people to go to your county health department website Facebook page, see what their plan is. Generally, they're communicating. A lot of counties just going by age. A few putting teachers up there or first responders, but trying to knowing that the comorbidities are with age more than anything else. And I know a couple of the major metros, Kansas City and Wichita, are both still working on 80 and above. That's just how slow the vaccine's coming in, but they're doing their best to get it out fast. I'm really impressed with the folks as they're leaning in.
And I think it's important to reiterate, and we talked a little bit about this last week with Marcy, but I always worry who's coming in that hasn't seen this before. So Kansas gets, we are 1% of the population of the United States. So we are allocated 1% of whatever is available for vaccines. So that's kind of where you see the 40,000, the 50,000 number that comes in each week. We did get notice last week that prior to, I guess, probably this week or next week, we would only get about a 1 week lead time on vaccine and how much was coming. And so we could kind of then plan the state code as to where it would go. And we are being told that they're working to develop a system to give us 2 to 3 weeks of lead time from the federal government so that we can plan a little bit better where we can do those vaccines and how many people they can plan for moving forward. I did hear a question this morning around, have we had any issues with people getting their second vaccine? And the report resoundingly was people are getting their second vaccines. They're not having issues getting them scheduled or getting the vaccines to them. So I think that's another ray of light in this time.
Absolutely, Reagan. Thank you. I'm going to show here also what we usually see from Dr. Watson with Cheyenne Mountain software in the Mission Control app. But you can see a lot more green and yellow in the hospital capacity for transfers. That just a couple weeks ago was mainly red. So we're seeing capacity open up in the system. That's shown up in the transfer time. You remember when COVID patient was about 4 hours to find a hospital to transfer. That's down to an hour and a half. Non-COVID's about an hour. Good news there as well. And why I have it, I'm going to switch to a bright spot real quick. Well, Reagan, is there anything else you'd want to talk about? I
think that's it.
Well, let me share. We like to share bright spots on here. This was shared out of the. Are you seeing the picture up there? Right. Okay. Out of the Northeast, where they vaccinated at a VA, a lot of people that were born around or before World War II, and you can see they all, as they were getting their vaccine, were asked to write, why they chose to get it. And I have a couple of the quotes here for you. Let's see. For me, my family, and the veterans that we serve, because COVID stinks, which we can all agree on. For my 91-year-old father, to keep him safe. Marines lead the way. You gotta love it. It's great to see the people that are getting vaccinated, these populations that are really vulnerable, and especially people who have served our country in this way. Also, just important to mention, the Chiefs are playing a football game, I think, this weekend, if you've read about it. It's called the Super Bowl. NFL is doing something cool. It's only 25% capacity in there. Really hard tickets. Lower bowl tickets are going for $30,000 a piece. But they've elected to put 7,500 frontline vaccinated workers in, and there's quite a few Chiefs fans. One of them that was picked was from Hayes, and I want to make sure I've picked up the right story here. I got it right here. Her name is Kelsey, if I'm right. Yeah, Kelsey. And first time on an airplane, first time on a beach, huge Chiefs fan, out of Hayes, America, here in the Northwest region, getting to go cheer on the Chiefs for a repeat of the Super Bowl. I just love, the spirit of all these frontline workers, so humble. It's been hard for me to accept the ticket because I know there are so many people, nurses and healthcare providers, that have put in so much work. It's hard to feel deserving of this. So the fact that they thought I'd be a good representative is a huge honor to me. So just some great people out there. We can all agree to cheer on the Chiefs. Now be smart about how you watch it. COVID is still around and still going, story I've shared on a couple of these other calls. Last year, they actually credited the Chiefs winning the Super Bowl with saving lives. The coronavirus, unknown at that point when the Chiefs beat the 49ers, was already going around the San Francisco area. And so had they held the parade to celebrate the 49ers, there would have been a super spreader event, but it had not quite gotten to near that level in Kansas City. And so let's be smart again this year, help the Chiefs save lives. You're going to want to be loud. Ventilation's a big deal, but try not to be with too many people as you're cheering them on. All right. So good bright spots out there. Stay vigilant, not the time to let up. Keep getting tested, and we'll be back 2 weeks from now, February 16th. Please go on, sign up with your email. Website again is covid.ks.gov, covid.ks.gov/report-outs. And with that, we're out. So Reagan, thank you very much. And